we saw an incredibly damaging continuation of the reckoning and retribution campaign by the Trump administration, a totally illegal and unprecedented in this country's move around Medicaid. And you're going to hear again from the team that's here can explain what's going on with CMS, with Dr. Oz, and then adding the vice president into this.
You were told the federal government just cut off healthcare funding for vulnerable Minnesotans as revenge for the last election. That framing was designed to make you feel like asking questions about the money made you heartless. That scrutinizing where the dollars went meant you didn't care about the people who need this program. It wasn't. Because here is what that framing requires you not to know. An independent audit found $243 million in unsupported or potentially fraudulent Medicaid claims in Minnesota. It found $15 million paid to individuals without satisfactory immigration status. And the governor of Minnesota, Tim Walz, has not disputed a single one of those numbers. If the political retribution framing succeeds, if acting on a documented audit is ruled illegitimate because of who the governor voted for, then federal Medicaid enforcement is optional. And if it is optional, every dollar that just got protected goes back out the door. I am John Dray. Let us follow the logic. Let's start with what happened and what the law says is supposed to happen when it does. Medicaid is a federal state cost-sharing program. The federal government provides matching funds, the federal medical assistance percentage, in exchange for states meeting specific requirements around eligibility, coverage, and program integrity. That compact has a documented enforcement mechanism written into the Social Security Act since 1965. 42 U.S. Code, Section 1396C. The Secretary of Health and Human Services may withhold federal matching funds when a state fails to comply. The statute does not require the state to be running a criminal enterprise. Failure to maintain adequate program integrity systems, the failure to prevent fraud, is itself a compliance deficiency that triggers the withholding authority. The administration is not inventing new legal powers here. It is enforcing the law that has governed this program for 60 years. Now, what did the Minnesota audit actually find? The audit identified $243.8 million in unsupported or potentially fraudulent Medicaid claims. These are claims that could not be supported by the documentation the program requires. They were paid. The money left the federal treasury, and they were not caught by the state's program integrity systems, because those systems were not operating at the standard federal regulations require. Separately, the audit identified $15.4 million in claims involving individuals who lack satisfactory immigration status. Under federal law, Medicaid funding is restricted to citizens, qualified immigrants, and certain lawfully present individuals. Minnesota paid $15 million outside those categories. Governor Walz has called this political retribution. He has not disputed those numbers. The federal response was the deferral of $259.5 million in federal Medicaid matching funds, pending a corrective action plan from the state. Not a permanent cut, not a termination of eligibility for Minnesota residents, a conditional pause on the federal match, which the statute explicitly authorizes, until the state demonstrates it has fixed the systems that produce those audit findings. Here is the part of this story that is not getting covered. If $243 million in unsupported claims existed in Minnesota's Medicaid system, those claims were processed and paid under the previous administration's model. The fraud is not new. What is new is the enforcement. For decades, federal healthcare regulation operated on what CMS itself calls the pay and chase model. Pay the claim first, detect the fraud later, attempt to recover the money, and typically recover a fraction of what was stolen. The model was not failing. It was succeeding at what it was designed to do: process claims quickly, at scale, with minimal friction at the point of payment. The CRUSH initiative, comprehensive regulations to uncover suspicious healthcare, is the transition from that model to what CMS calls detect and deploy. Artificial intelligence trained on billing pattern anomalies, real-time flagging, verification before payment rather than investigation after, padlocking the jar instead of chasing the thief, and the early results are not modest. Minnesota is the first major action under the CRUSH initiative. It is not the only one. CMS data confirms that the administration has suspended $5.7 billion in suspected fraudulent Medicare payments. Not deferred, suspended. Money that was going out the door under the old model and has been stopped. $1.5 billion in fraudulent durable medical equipment billing, wheelchairs, prosthetics, home oxygen equipment has been prevented by the new program integrity safeguards. 5,586 Medicare and Medicaid providers have been revoked. 122,658 individual claims have been denied after failing medical necessity checks. And 372 cases, representing $3.7 billion in allegedly fraudulent billing, are now in the pipeline for federal prosecution. Let me give you the larger context. The Department of Justice's most recent national healthcare fraud takedown resulted in 324 defendants charged in connection with over $14.6 billion in alleged fraud. $14.6 billion. That is not an abstraction. That is money that was supposed to pay for medical care for the most vulnerable Americans and instead funded criminal networks. And the model that allowed it, pay the claim, chase the fraud, was the default operating procedure for the program before this administration changed it. Now, I will tell you what the administration has also said about the border, because it is relevant context for understanding what this doctrine is. The administration has credited its border and maritime enforcement policies with a 96% reduction in sea-based drug trafficking and a 67% drop in fentanyl inflows. Those figures come from administration statements and have not been independently confirmed against a primary government data release. So I am telling you what the administration has said, not vouching for the specific numbers. What is confirmed from the Department of Homeland Security's own data is the border picture I covered in the Hemispheric Fortress episode. The point here is the same doctrine connecting the dots. External threats addressed with hard power, internal systems secured with accountability. The same administration, the same week. Let me address the counter-argument directly, because the strongest version of it is not that the audit is fabricated. It isn't. No one has said the $243 million didn't exist. The strongest version of the retribution argument runs like this. All states have some level of unsupported claims in their Medicaid systems. This is an inherent feature of a program that processes hundreds of millions of claims annually. The administration chose to audit Minnesota, a state governed by Kamala Harris's former running mate, immediately after the election. And it has announced a similar probe in New York, another Democrat-led state. The pattern, they argue, is the tell. That is a serious argument. The retribution argument requires two things to be simultaneously true. First, the audit findings are real, and they are. Second, acting on those findings is illegitimate because of who the governor voted for. Think about what that second claim actually does. It takes the documented compliance failure, $243 million in unsupported claims, and argues that it should be shielded from enforcement by the political identity of the executive who presides over it. That is not a legal argument. That is a political one. And it would establish a precedent that federal program integrity enforcement is optional whenever the state being audited can make a convincing case that it is being targeted. Now, did CMS audit Republican-led states? The administration has not published a full list of states under review. The absence of reported audits in Republican-led states is not evidence that they are not happening. The audit trigger in Minnesota was documented. CMS identified unusually high spending and rapid growth in personal care services and home and community-based services. That is a data threshold. It is not a party registration check. And here is the detail that the retribution framing most reliably omits. The deferral is not a cut. It is not a termination of eligibility. Minnesota Medicaid beneficiaries remain eligible. The state retains the option to continue paying claims from state funds while it implements its corrective action plan. What is withheld is the federal match, conditionally pending compliance. That is the law. That is what the Social Security Act has always said happens when a state's program integrity systems fall below the required standard. The governor has characterized that consequence as retaliation. He has not filed a legal challenge contesting the audit findings. He has not disputed the $243 million number. The argument is not the audit is wrong. The argument is acting on a correct audit is wrong when it happens to us. Run the logic bridge test. The audit is documented. The findings are uncontested. The statutory consequence is prescribed. The only variable the retribution argument introduces is the party affiliation of the governor. That is not a defense of the program. That is a defense of the failure. Let me bring this home. Medicaid is a federal-state compact. The federal government provides the funding. The states administer the program. The law governing that compact has always included an enforcement mechanism, because a compact without consequences is not a compact. It is an expectation. The Crush Initiative is not an aggressive new assertion of federal power. It is the enforcement of a condition that has been in the statute since 1965. What is new is the technology, artificial intelligence that can identify billing anomalies in real time before the money leaves the Treasury rather than years after. And what is new is the willingness to actually use the enforcement mechanism when states fall below the required standard. Here is the moral stakes of this story, stated plainly as logical consequence. If the retribution framing succeeds, if acting on a documented audit is characterized as illegitimate targeting, and that characterization is accepted, then the precedent is established. Federal Medicaid enforcement is optional when the state being audited can claim political victimhood. And if it is optional, the $5.7 billion in suspended fraudulent payments goes back out the door. The $1.5 billion in prevented billing fraud comes back online. The 372 prosecutorial referrals face a headwind of selective enforcement. Every state with a documented compliance failure gains a political defense against the consequence the statute prescribes. That outcome does not protect vulnerable Minnesotans. It protects the administrative systems that failed them, the systems that processed $243 million in unsupported claims while those Minnesotans were supposedly being served. The Americans who bear the cost of this story are specific. They are the 67 million Medicare beneficiaries whose premium costs are directly connected to the solvency of the program. They are the taxpayers whose federal withholding funded the $243 million in unsupported claims. And they are the legally eligible Medicaid recipients in every state, including Minnesota, whose program competes for dollars against claims that should never have been paid. Those are the people the political retribution framing is not protecting. The next time someone tells you the administration is just targeting blue states for political revenge, ask them one question. Did Governor Walz dispute the numbers in the audit? Did he say $243 million in unsupported claims didn't happen? Did he produce documentation showing the $15 million in payments to individuals without legal status or properly authorized? He hasn't, because those numbers are correct. The governor's argument is not that the audit is wrong. It is that acting on a correct audit is somehow illegitimate because of who he is politically. Those are two entirely different arguments. Only one of them has anything to do with Medicaid. And if you want the national scale, the government just suspended $5.7 billion in suspected fraudulent Medicare payments. Under the old model, that money was going out the door. If the retribution narrative succeeds in reversing this enforcement posture, ask them what the plan was for the $5.7 billion. That question does not have a comfortable answer. I want to bring this back to where we started. You were told the federal government was punishing Minnesota for voting the wrong way, that the administration was using a healthcare audit as a political weapon against vulnerable people, that the story was about cruelty dressed up as fiscal responsibility. The audit found $243 million in unsupported claims. It found $15 million paid outside the legal eligibility requirements. The governor has not disputed either number. The federal response, a conditional deferral of matching funds pending a corrective action plan, is the exact consequence the Social Security Act has prescribed for exactly this outcome since 1965. Nationally, $5.7 billion in suspected fraudulent Medicare payments have been suspended. $1.5 billion in fraudulent equipment billing has been prevented. 372 cases are headed for prosecution. None of that is revenge. All of it is the law, functioning as written. The political retribution framing is not an argument about what the audit found. It is an argument that the people who failed to prevent $243 million in unsupported claims should not face the statutory consequence for that failure because of who their governor is. That argument deserves to fail on its merits, and now you have the merits. The fraud was not new. The enforcement is. Remember the difference. Stay skeptical. Stay informed. I'll see you next time.